And on my website, we get a lot of questions, and I thought we'd read some of them and go over some of the answers to those questions in the event that it might help you. The website is www.petpointers.com, and you can ask questions there yourself that'll get answered. So go to the website, and in the meantime, we'll answer some of these questions. Sometimes people want to know, is it an emergency or not, especially on a weekend? You know, what kind of emergencies should you pick your animal up and go right to an emergency clinic versus wait until Monday to have your veterinarian look at it? And it's a very, very good question. We talked earlier about the 4 basic things that you want to know what your cat is doing every day. Is it eating? Is it drinking? Is it passing stool? Is it passing urine? All those things should be in normal amounts, and if there's changes in that, it's something to be aware of. Cats or dogs that are vomiting, you want to not worry about a cat too much if they're, say, vomiting once a week and they're normally keeping their food down and they're acting normal in every other way. Cats that are vomiting every day or 3 or 4 or 5 times in a day really should be seen right away, because we talked earlier about the possibility of antifreeze, kidney failure, liver failure, other problems that need instant intervention. So again, part of knowing those 4 different facts of your cat's eating, drinking, passing stool, and urine, also their demeanor. Are they sleeping all day when your cat's very active usually? Is your cat crying out? Is it semen pain? All of those things are factors you have to weigh to determine if you're going to take your cat in right away or not. I always say err on the side of at least calling the emergency clinic or calling your regular veterinarian to find out if it's an emergency, because they'll ask very pointed questions about what your cat's doing at that point in time and help you decide if you need to be seen or not. Almost all of the veterinary emergency hospitals that I know of don't charge for that, so if there's any question at all, pick the phone up and call the clinic and find out if it's an emergency.